And for now, they make a big dichotomy between what is cosmetic and what is reconstructive. So, you know, something that alter the appearance just for cosmetic purposes versus having a function. One would argue that the line is very thin between the two, and that's the point we try to make when we have to appeal the insurance denials. And some of the problems actually have to do with just how the insurance works, and that's just based on, you know, CPT codes in the US and being very gendered code, for example, and not really reflecting our reality on the field of what we're trying to do. And probably this also has to have, you know, a lot of work to be done to reflect what we're doing with new codes as well, so we can actually just have that accordingly to what we're doing. When we talk about, you know, medical necessity insurance coverage, those are two different things. You can be considering that it's medically necessary, but then depending on the country where you're from, it could be covered or not. And people tend to make a line between what they consider cosmetic versus reconstructive. I think in plastic surgery, the line is very thin sometimes. And I actually wrote a paper a few years ago saying, should we consider a cosmetic or reconstructive procedure, gender affirmation surgery? And of course, to me, it should be considered reconstructive in the sense that it should be covered. And I think that, you know, the way I was explaining that to people was to say, we are at a point where we're asking ourselves if we should face transplant some individuals that were completely burned and blind. And so it means that we do understand that their interaction with the world actually changes because of their face, even if they're blind, right? So just for the sole purpose of that dichotomy, I said, well, can you imagine not having the body that you should be in, and now your social interactions are not going to be great either. So so definitely we should go towards that direction. And I wrote that because I was very angry actually at the editor putting all the papers of gender affirmation in the cosmetic section. And I said, if you keep doing that, what's going to happen is that someday some insurer, and especially now, you know, seeing what happens in the US with a lot of fightbacks, some insurer is going to say, well, if it's cosmetic, we're just going to stop covering it. And that's a huge danger.